will be talking on this. So all to you, Ananth. And Dr. Ananth is a senior phaco-refractive surgeon at the Lotus Eye Hospital and Institute, and he runs a chain, and he's a high volume prolific refractive and an ICL surgeon. And all to you, Ananth.
Thank you, sir. Good morning, everyone. At the outset, I would like to thank Star Surgical for considering me for this session. I'll be speaking on Collamer, a game-changer Phakic IOL material. If I just say Collamer is all alone in the game of Phakic, it would not be an exaggerated statement. If I do not say it, it can be an understatement also. I'm just high-volume surgeon and speaker trainer also for the surgery. If you speak to any Phakic IOL surgeon, if you ask them, they will always say ICL surgery is one of the most rewarding surgery out of all the anti-segment surgeries they do. This surgery is the only one which gives the fastest visual recovery. You'll see absolutely quiet eye, non-inflamed eye. You see the post-op, it's absolutely quiet eye. And one of the most easy surgeries to perform, and you'll always have least complication with this surgery. All this happens only because of this material, Collamer. I owe all the success of Phakic surgery to this material, Collamer. Collamer means it's biocompatible. It is almost synonymous with this word. It's a copolymer. It's a copolymer of 0.3% porcelain collagen and 60% hemocollamer. It is hydrophilic in nature, almost 35% water content. It has got an inbuilt UV blocking chromophore. You see the refractive index here, it's around 1.45. The normal natural crystalline lens is around 1.42. It is slightly higher when compared to normal crystalline lens. No other material will have so much of light transmission. It is almost 99% light transmission. These are all the beauties of Collamer. Because of which, of its hydrophilic nature, it is very soft and flexible. Normally, all human beings, we do have fibronectin in our aqueous. This fibronectin has got a special affinity for the collagen which is present in the Collamer. This gets adhered and forms a coat. Since it's forming a coat on the Collamer, the anterior chamber of our eye doesn't detect this as a foreign body. That's the reason we absolutely get a non-inflamed eye or a non-red eye post-surgery. This is the most important thing. And secondly, the collagen of this Collamer is negatively charged. It always repels the proteins which are present in the aqueous. It repels, so you never get the protein deposition. 20 years down the line, the patients which have been operated for ICL 20 years back, when we are explanting now, you can see the lens as crystal clear. The proteins are never deposited at all. Unlike non-Collamer materials, you do have tendency to get the deposition. As I mentioned, the refractive index is slightly higher than the normal refractive index of crystalline lens. You don't get any deflection. As the material changes, for example, non-Collamer or acrylic material, the refractive index goes more than 1.48, chromatic aberrations are induced. That itself can cause dissatisfied vision, but that doesn't happen with Collamer. And we are making very peripheral incisions. We are not inducing any aberration. Prolet shape is maintained, and light deflection do not happen. Coming on to the safety and efficacy, even without central flow, the amount of cataract tendency was very minimal. With the advent of central flow technology, the incidence has literally come down. Coming on to safety, in a quick hands, hardly surgery takes around 1 to 2 minutes. It's a quick time surgery. No significant endothelial cell loss has been documented. If you look into international literature also, there is no loss of endothelial cells. Wide range of treatment is available until -10 to -18 lenses are available. Other advantages, not only for myopics patients who are not suitable for LASIK, thin corneas, post-C3R patients, we have done it in post-keratoplasty patients also, post-LASIK regression patients where you don't want to do LASIK, yes, this gives. Coming on to visual recovery time, even if I do smile, that wow factor sometimes lacks. There will be pain, photophobia, irritation following femtolasic or LASIK. But with this eye, visual recovery is very fast. We do not use intracameral pilocarpine also. There will be no spasm. Patient will be able to see the good 600 and better within hours of surgery. So quantity, quality is good, so patients are happy. Any topical phacosurgeon can do this surgery. There is no need for extra investment like femto or excimer. The results are not dependent on humidity or temperature. Even Dr. Sarapi, any topical phacosurgeon can start doing Collamer in this thing. As I mentioned, complications are very minimal after the invent of central flow. IOP is never issue. Cataract, as I mentioned, is never issue. Endothelium, TAS, we have well-equipped theatre centers, so never happens. Because of all these advantages, lakhs of Collamer has been implanted worldwide. So just to summarize, it's a biocompatible material, quality of vision is supreme, it's easy to handle, hydrophilic in nature, and efficacy, tolerance, safety has been proven over years. Thank you.
Thank you, Ananth, for that wonderful talk. So, any questions for Dr. Ananth? So, from the panelist.
Can you explain about central flow? That hole gives rings.
Gives?
A ring around the light at night.
Yeah, 360-degree micron hole rings appearance is experienced by few of the patients in the first few weeks, hardly 1 to 2 weeks. Later on, it doesn't cause any problem to the patient, sir. That's what I've seen.
And they get adjusted within less than 1 month.
Hardly 2 to 3 weeks.
Yeah.
Just to again reiterate the point that you spoke about, very well spoke about the biocompatibility of this material. So for example, like we recently performed somebody who had -30 diopters. Instead of performing, you know that now there are a lot of manufacturers who can actually customize the lenses for you and do -20, 25, 30. But we prefer to perform the star ICL along with the smile as the bioptics for them, because we know that in long term, the biocompatibility, the possibility of very, very less incidence of cataract will be hugely in favor of patients. So I think this point of the material being unique really helps our patients in long term.
Yeah, that's what we do also. Whenever the Collamer doesn't support the high power, I make a LASIK flap, go ahead with ICL, check the residual power, lift the flap 2 or 3 days later and correct the power.
Absolutely.
What has been your personal experience with the Collamer vis-a-vis the competition, the hydrophilic or hydrophobic, whatever they say, in terms of the cataract? Because I believe cataract is the only, in the series, the biggest complication with the phakic lenses so far. So what has been your personal experience with the Collamer? Do you feel that the Collamer is a little more safer and a little more biocompatible?
I personally feel it's very much safer, sir. Because I'm doing Collamer since last 8 to 9 years. I've seen my boss cases done since 2007 or 8. Hardly 1 or 2 cases have undergone cataract surgery. In my cases, I could see 1 or 2 touch in the side which has never progressed. My individual ICL cases last 7-8 years, till date, I have not done a cataract surgery, till date.
So
Collamer.
Can we take home this message that Collamer is much more biocompatible in terms of, causing these complications in terms of cataract and
low volt of 160, 180, we are able to see that still patients are doing good.
So do you think that the V4C, the central hole, also plays an important role in this with the, the physiological movement of the aqueous through the...
Could be, sir. That's also not... But looking back to the older ICL patients who are even before the invent of central flow also, the incidence of cataract is literally very minimal.
And the second best thing that I believe is that the moment you want to explant these lenses, the lens exactly comes to the same incision what you injected, vis-a-vis, these stiffer material. So thank you, Ananth. And now